Hi, I'm Dr. Sonia Malik from Nova South End Fertility and IVF, New Delhi. Let us talk about something which is quite interesting and pertinent as well and gaining a lot of importance lately. That is about male infertility. I now know that most of us are aware that it is not just the female which is the cause of infertility. It is a partner problem sometimes, and sometimes it may be a male factor problem, not the female herself. So therefore, more and more men are realizing that it could be a problem with them rather than their wives, and hence over a period of time we are seeing that which is a good sign that men are also coming forward to get themselves tested in order to know whether they have a problem or not. So let us talk about some of the common tests that we advise to our patients in order to know whether there is a male factor in infertility or not. The first thing is to examine the person, examination of the man just as we examine the woman, and to see whether his reproductive organ, that is the testicles and the penis, are all fine and there is no problem over there. Once we have done that, then the test that has to be ordered is a semen analysis. So a semen analysis actually tells us the whole story, because basically if the semen is normal, the male factor is ruled out. However, in the semen examination, either the count, the motility, or the shape of the sperm, which in our own technical terms is known as morphology or the face of the sperm, if any of these things is abnormal, then there is a chance that this person may actually be having a problem. So let me just talk about all these factors. What has happened recently is, many of you who have gone through these tests would know that over a period of time the semen quality is deteriorating and you are finding a male factor infertility increasing. Even the WHO now describes the total semen volume, or the total amount of semen count in a single sample has decreased from, say, from 60 million to 120 million, which it was in 1990s, to just 10 millions now. And it is in this latest volume of the semen analysis that has come out with WHO states that even with 10 you are normal. Similarly, for motility, it has to be about 40% in order to have a pregnancy, and the morphology has to be about 4% at least to have a pregnancy. If any of these factors there is a deviation, then there is a possibility that you may not be able to conceive with naturally, and you will require some kind of an assistance. So semen analysis by just these three parameters can actually tell us whether the person is normal or is definitely going to have some kind of problem in conception. So I would suggest that whenever you go for a consultation with any of your doctors, you must go through a semen analysis, or even if you're planning a pregnancy, you must go through a semen analysis in order to know whether you're normal or not. Thank you very much for being with me.